This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, Trinidad and Tobago. I hope that everyone is well today. Happy Spiritual Shouter Baptist Liberation Day in advance. And we also have other religious festivals in this wonderful society of ours. We're in the time of the Holy Festival, that's HOLI, for our Hindu brothers and sisters. And of course, going into the Easter weekend, we're in the Easter season right now for our Christian brothers and sisters. Welcome to another edition of the Ministry of Health's virtual media conference. We're here to provide you with accurate information on the ministry's COVID-19 response. Today in studio we have with us Dr. Miriam Abdul Richards, Principal Medical Officer of Institutions, who will give us the clinical update, and she will also provide this morning an update on the parallel health system. Then we go to Dr. Avery Hines, who's the Director of Epidemiology at the Ministry of Health, and he will give us the epidemiological update. And then we go to Ms. Camille Campbell, counseling psychologist with the Northwest Regional Health Authority, and she will bring us some information on how we can cope with pandemic fatigue. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this morning. We go now to Dr. Richards, who will give us the clinical update and an update on the parallel healthcare system.
Thank you very much, Candice. My esteemed colleague, Dr. Avery Hines, and my colleague from the NWRHA, who will provide us information in terms of coping with the COVID-19 pandemic. Good morning to members of the media. Thank you once again for your continued attendance. Good morning, Trinidad and Tobago. This morning, I would like to provide an update on the parallel healthcare system, which consists of an update in terms of the clinical statistics, as well as an update on the ongoing repatriation exercises. At this point in time, I would like to really thank all persons who are involved in the parallel healthcare system, not just the frontline medical staff, but also the persons who are involved in the repatriation exercises and the transfer logistics for the safe and controlled return of our nationals, as we strive to keep our nationals, their families, and our population safe. In this regard, I would like to commend the efforts of the Ministry of National Security staff, starting with the exemption desk, the Trinidad and Tobago Defense Force, the members of the Customs and Immigration Department, as well as all the Ministry of Health frontline staff who have been providing selfless service to the population of Trinidad and Tobago since March 2020. At this stage, I would like to provide the clinical update as per 4 p.m. on March 28, 2021, and this is the figures that are consistent with media release number 677. As of 4 p.m. yesterday, 108,358 COVID-19 tests have been done in public and private facilities across Trinidad and Tobago. Of these, 7,977 have been confirmed as positive. Over the last 48 hours, there were 23 confirmed cases of COVID-19, taking the active number of cases to 240. These cases are distributed as follows: 14 confirmed positive cases at 3 of the hospitals in the parallel healthcare system. There are 7 cases at the Couva Medical and Multi-Training Facility, 4 cases at the Cora Hospital, and 3 cases at the Scarborough Regional Hospital. Additionally, there are 4 confirmed cases at the Debe Academy Step-Down Facility, while there are 199 cases in self-isolation. Thus far, we have had 142 deaths since March 12, 2020, and we would like to extend our sincere condolences to the families and relatives of these persons. At present, in our state and state-supervised quarantine facilities, as of this morning, there are 309 persons representing repatriated nationals. At this point, there are 12 state and state-supervised quarantine facilities currently in operation. It is important to note that, given the recent upsurge in cases, which my colleague Dr. Hines will speak about, we are noticing an increase in the occupancy of the hospitals in the parallel healthcare system. Over the past 10 to 12 weeks, the parallel healthcare system, in terms of hospital occupancies, has been at a rate of about 2 to 3%. However, as of today, that occupancy percentage has increased to 7%. The percentage of ambulatory beds that are occupied in the parallel healthcare system has also increased from about 3% to 6% as of today. And this really emphasizes the need for us to continue to be vigilant and to exercise our COVID-19 prevention measures, which are the 3 W's: wear your mask, watch your distance, and wash your hands. I'd like to also provide an update on the repatriation exercises, which are led in collaboration by the Ministry of National Security. And we had a successful exercise on Saturday evening, which was March 27th, in which there was a return of approximately 95 persons from Barbados to Trinidad and Tobago. And we would like to say that all persons were received in a very safe manner and are currently accommodated at our state and state supervised facility. Over the next 3 weeks, there are 5 further repatriation exercises that are scheduled. On March 31st, there's a repatriation exercise from Miami to Trinidad and Tobago, and as of this morning, I am informed that there are 130 confirmed ticketed persons. On April the 8th, we have an exercise from New York City, April 14th, Canada, April 16th, Barbados, and April 21st, Miami. The government of Trinidad and Tobago is committed to ensure that all returning nationals are received in a safe manner, and as such, we are anticipating approximately 130 persons per flight. As I close this morning, I would like to again remind the population to please heed the COVID-19 prevention measures, especially as we approach the Easter vacation, where there would be a lot of mixing of persons. So now I hand back over to Ms. Alcantara. Thank you.
Thank you very much, Dr. Richards. And we go now to Dr. Hines for the epidemiological update.
Thank you, Ms. Alcantara. Good morning to Dr. Richards. Good morning to Ms. Campbell. Good morning to members of the media, members of the viewing and listening public. I'd like to go straight into my slides. We can actually skip directly to the second slide. The epidemiological update for today contains all the information up to March 28th at 4 p.m. And again, what we are showing with the epidemic curve in particular is that focus on the orange bars over to the right-hand end of this curve and the black line that runs through them. That black line representing what we call the rolling average of cases calculated over a rolling 7-day period. And what we can see with that line and with the general trend in heights of those orange bars is that we are getting a steady increase at this point in time in the number of cases that we are seeing on a daily basis, on a weekly basis. And that rolling 7-day average has gone from a low of 3 to its current position of 17. So that's approximately 17 new cases being accumulated on a daily basis. And this upward trend is a cause for concern, which we will speak about in a little more detail. Let's go to the next slide. The next slide shows something similar, but aggregating the data over weekly periods instead of daily. So the skinnier bars in the previous epicurve were daily numbers. This weekly representation gives a better idea of that trend. You can see the orange bars again representing the weeks in March getting progressively taller. And we can see that the background, there's a background shadow, an orange or salmon color behind it that actually represents the percentage of cases that are positive out of the people who we swab for respiratory illness. So whereas earlier on in the epidemic, during the height of the epidemic, we would have seen percentages as high as 43 and 44% of everyone who was swabbed having a positive result for COVID, that eventually dropped as we came into the beginning of the new year to 2 to 3%. February was 2 to 3%. And we're now seeing that percentage of positivity beginning to rise again, currently 6% as at the end of the last epidemiological week. So we are seeing that there's an increase in the overall prevalence of the virus circulating among the population and showing up in those individuals who come to the health centers, to the hospitals, to the emergency rooms to be swabbed. One of the things we also noticed, and we mentioned it at the press conference on Saturday, is that the overall increase did begin approximately 2 weeks after one of the relaxation measures that had been announced on the 21st of February, and that was the relaxation around some of the larger gatherings for sporting activities, larger group sport activities. And while we note that the sporting activities themselves, the sporting exercises, may not be the immediate driving factor, certainly the gatherings before, during, and after may be driving some of this exchange, along with the increased tendency to gathering that we seem to be seeing in the general population. And again, we'll circle back to that in a little more detail. Next slide, please. So the demographics have remained largely the same. Cumulatively, we've noted that about 55.2% of the total COVID cases fall into that working adult age group of 25 to 49 years of age, and that just over 53% of the COVID positives have been men. And as we move to the next slide, we see that that distribution differs from the individuals who've had fatal outcomes, where men outnumber women by approximately a ratio of 3 to 1. So we have 73.9, nearly 74% of the COVID fatalities being male. We also note that about 2/3 of those COVID fatalities were in individuals 60 years and above, and that among those who had a fatal outcome, the presence of one or more what they call comorbid conditions, one or more pre-existing chronic illnesses, was noted in more than 80% of those who passed on. So we note that both the age and the presence of comorbid conditions are risk factors for an adverse outcome, but that the people who did have adverse outcomes were not restricted to either of those categories, so that everyone still needs to be aware of the risk of COVID-19 and potential fatality. Next slide, please. What we're going to go into now is a sequence just showing the changes week by week. The graph that we're seeing to the left-hand side of this map shows us the number of cases by county, the purple being a week before, and the yellow showing the current week under consideration. So we start comparing 2 weeks, Epi week 7, which is in purple, with Epi week 8, which is in yellow. And those colors are also represented with the dots on the map itself, showing the distribution of the cases across the various counties. So we see we're using this one as baseline, starting with Epi week 8, and we move to the next slide, where follow the yellow dots. Next slide. We see again, that's a sort of a decrease overall around week 7 to 8. The cases were on the downward trend, so there were fewer yellow dots than the week before. But as we move on to week 9, next slide, we start to see an accumulation, increasing numbers of yellow dots, especially in that County Caroni area to start with. We also saw some in the St. Patrick and the Victoria area and along the east-west corridor, even one or two in County St. Andrew, St. David. As we move forward again, next slide, we see that sort of distribution moving into other locations. Next slide, continue to look at the yellow dots. And we see that spillover and also an increase in number of these yellow dots, increasing numbers of cases being identified across a wider span of the population and a wider span of the geographic landmass. Next slide. And this would bring us to Epi Week 12, where we're seeing the yellow dots now concentrated across the sort of the population centers from Pinal through Caroni all the way up to some parts of the East-West corridor. And this is really the spillover that we would have spoken about when we had addressed these maps and the progression in previous press conferences, where we saw it start off with a lot of connected cases in one county and then additional spillover from week to week. So if we move to the next map, we get a better area of that sort of cumulative numbers of cases by community over a 2-week period. We're looking here at Epi weeks 11 and 12, with the darker red colors indicating higher numbers, the numbers reaching as high as 11 in the darkest red communities. And you see where those are sort of concentrated in counties Caroni, Victoria, and St. Patrick. And as we move forward to the next slide, we see each county represented showing its numbers of cases from week 8 moving through to week 12. So each group of bars that we see here is a given county looking at cases from week 8 in blue to week 9 in orange to week 10 in grey to week 11 in yellow and week 12 in blue. And we see quite clearly here the numbers of cases in Caroni outnumbering many of the others. And although Caroni's cases have begun, at least seemingly, to come down from week to week, from week 10 to 11 to 12, we're seeing the exact opposite in some of the neighboring counties, again indicating that spillover and an increasing trend from one week to the next. Okay, finished with the slides. Now, this trend is what we are drawing our attention to. This trend is a cause for concern, though not alarm. This trend is a cause to reflect on what we may be doing or what we may be able to do as individuals and as a population to halt and reverse that upward trend. As we've been told on numerous occasions, all of the public health measures that we are currently engaging in, all of the regulations that are in place, all of the recommendations that we continue to make are our barrier between ourselves as a population and the spread of this virus. What we have seen, and our colleague Camille will speak about it in a little more detail, is people seeming to get a little tired of doing the right thing, the inconvenient thing, the distance thing, the mask thing, the hand washing thing, the not gathering thing. And the extent to which we change our behavior at this point in time is going to change the rate at which the virus can spread through the population. We've seen on social media some of those pictures of gathering, milling around in public spaces. Again, understandable and understood. People want to get out, people want to do things, people want to entertain themselves, but we still have to be aware that we are in the midst of a pandemic, and that the gathering that we're seeing, the crowds of individuals, and then crowds of people exhaling into a common space and possibly sharing infected respiratory droplets with one another. The tendency to gather indoors, to exceed the numbers of individuals that should be gathering in a given space, the tendency not to wear masks at work or in other places where we're gathered, all of these things, as we relax on these measures, we give the virus additional opportunities to spread from one individual to another. And it's important to emphasize that right now we're moving into the holiday season. We're moving into the Easter holiday season with kids away from school, with individuals looking to travel either to Tobago or to wherever they're going. We do need to maintain even more so the behaviors that will protect ourselves and protect others from becoming infected. Because even if, as we've pointed out, even if we, the younger population, may not immediately have adverse effects, we can get ill and we can carry that illness back home to other more vulnerable members of our own households. And this is something we really want to avoid. We are asking again for the population to pay attention to those 3 W's: the wearing of your mask, the watching of your distance, and the washing of your hands. And with watching your distance, we don't just mean individually, but we also mean the avoidance of crowds, the avoidance of congregation and clustering. So I'd like to tie this part of it up by reminding the population that the COVID-19 virus is still a clear and present threat to the well-being of the population. We are experiencing an upward trend that we can halt if we double down on those preventive behaviors, we double down on following up with the public health regulations and guidelines. And there's a great degree of individual responsibility that is going to be needed to reverse this trend. And with that, I'd like to turn back over to Ms. Alcantara.
Thank you very much, Dr. Hines. We are going into a series of national holidays or religious observances and festivals, as I mentioned earlier, between this week and next week. And it's very possible that pandemic fatigue may cause us to make some irresponsible decisions. And so that's why we have Mrs. Campbell here with us, who will speak to us about some of the coping mechanisms which will help to keep us vigilant, especially as we go into this upcoming religious festival period. We go to Mrs. Campbell.
Good morning, everyone. Ms. Alcantara, Dr. Richards, Dr. Hines, members of the media and the wider listening audience, a hearty good morning to all. I am humbled by the opportunity today to speak with you about pandemic fatigue. So have you ever had a goal that you set for yourself? We can start off quite determined, quite focused, but somewhere in the journey we become very weary, fed up, and wanting to give up. That's how many of us might be feeling at the moment with this pandemic. We might be feeling tired of having to wear a mask, having to be alert and mindful not to touch our faces, or always washing our hands. We can't gather as we're accustomed to, and our social interactions are devoid of physical contact. These feelings are quite normal, and it is expected, especially because of this prolonged public health crisis. 1 year ago, we had limited information about COVID-19 and its effects. Persons may have adhered to the guidelines of washing their hands and wearing their mask and social distancing due to fear of the unknown. You know, we were hearing people, we needed to do it, and we were doing it not thinking about it because we were not sure what we were actually dealing with. I know of persons who would have sanitized their shoes when they came back home, or even wiped the groceries after purchasing them in an effort not to contract this virus. Persons were very strict on not visiting family members and friends, especially the elderly. We may have felt like we had no control over this invisible threat. However, 1 year later, persons may perceive this threat of the virus as if it has decreased because it is there for so long. We have become accustomed to it. That's a dangerous place to be, as the virus is still a real threat. Some of us desire the need for freedom, as we may feel restricted by the inconveniences. I have found that when we are at these moments of frustration or wanting to give up, it's important to refocus on the initial goal. So what has been our goal over the last year? It was to keep our loved ones safe, our elderly parents, our children, and those we love, ensuring we do all in our power to stay COVID-free. It is during these times of feeling weary and tired that we now have to dig deep for grit and resilience. We have to be vigilant and guarded. Your unguarded moment can have adverse consequences. We all have a personal responsibility to wear a mask, wash your hands, and avoid gatherings. The power of choice is now in our hands. I know that we spoke a lot about the holiday season with both Ms. Alcantara and Dr. Hines, but the truth is, this is a time where school is closed, and I know parents may be looking forward to this time of just relaxing with their loved ones and their children. But we need to do so in a safe manner. So here are some things that we can do to cope. We can still spend time with family, especially our loved ones, through social media. Social media is a great tool that we can use to keep us connected. We can also enjoy activities, but stay within the guidelines of 6 feet apart, wear your mask, and wash your hands. Enjoy the outdoors, but be mindful of the times when crowds may be more prevalent. My family loves going to a beach in the southwest region, and we tend to go to the beach in the evening time because it's less crowd. So we reach there around 4 o'clock, and that's the time when the crowds are actually leaving. So we are not saying don't have a sense of normalcy or don't enjoy yourselves, but we want to do so in a responsible manner, not bringing danger to yourself or your loved ones. Now, monitor and be aware if you are out and the crowds are growing. I paid attention recently to a new movie coming out recently, and persons were quite excited to see it on the day of release. Now, something like this, you can choose the time of viewing, whether it is late in the evening or the 10 o'clock time of viewing when it has less people. Or you can do like others who will delay gratification and view the movie at a later date. So parents, we want to do things with our children and our loved ones that will keep us connected and engaged, but safe. Take a road trip. I don't know how many of you still build kites or do things with your children in that way, but we can become creative as parents so that we have that sense of normalcy. We can even pay a visit to our local tourist attractions. There are many things that we can see in our country that are providing, and the COVID restriction guidelines are there as well. On a personal level, we can ensure that we get enough sleep, eat properly, and exercise regularly. We can do these exercises routines even at home and include our children with it. Knowing yourself is so important, and paying attention to your feelings. So persons may be experiencing pandemic fatigue and may be feeling sadness or loss of interest, anxiety, or even bouts of anger towards this pandemic. If you are experiencing any of these symptoms, don't stay isolated, but reach out to a loved one, a family member, someone in your faith or your circle, or even visit our mental health clinics. We can only relate to things that we have experienced. Some of us really can't experience or relate to this COVID-19 because we have not contracted it, or we may not have lost a loved one due to the illness. So it's almost like the virus is distant to us. We may feel invincible thinking that we cannot contract it. Experience gives us 20/20 vision. However, it sometimes comes at a cost. 1 year later, we have research to show the virus and its deadly effects and the economic fallout that it can have. So I encourage you today to make a decision. Wear your mask, wash your hands, and practice social distancing. There's an added saying that I would like to leave with you today. Let's learn through wisdom and not through experience. Let's not have to lose a loved one or contract the virus due to complacency, but let's keep our goal at the focus and remain guarded, guided by the protocols, and vigilant. I do thank you for the opportunity for sharing today.
Thank you very much, Mrs. Campbell, for those words of encouragement. And as we move into the question and answer segment, we remind members of the media, please ask 2 brief questions, ask both at the same time, and just indicate to us the entity that you represent and your name, please. Of course, we'll try to go as quickly as possible and come back to you if you have additional questions. We begin this morning with Guardian Media Limited.
Morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question is to the panel. I don't know who would be able to take it, but on Saturday, the Minister of Health did indicate that we're expected to receive that first batch of vaccines from COVAX tomorrow on Tuesday if everything goes according to plan. At this stage, just over 24 hours from when we're supposed to receive it, do we have any definitive word that yes, 100% sure we're getting it tomorrow, and as all the logistics in place to receive, transport, and store those doses? And my second question is to Dr. Hines. What percentage of our vulnerable population, that is, do you think that 33,000 doses would be able to cover?
Okay, thank you for your questions, Mr. Khan. I'll actually take them both. As at this moment, we haven't had any change in the scheduled arrival. So while I will not say 100%, we have not been advised of any changes to the schedule at this point in time. However, I can assure you that the logistics for receipt, storage, distribution are all in place, and that we are ready to receive and to roll once the vaccines land. So that takes care of the first question. The vulnerable population is a part of the vaccine strategy, but as I'm sure you've heard us say on a few occasions, there is a sequence, a process, and that process begins with the healthcare workers and then the individuals who are over 60 with the comorbidities. And we will run all the way through and vaccinate as many as possible, and then continue once we get additional supplies of vaccine. So we're not really looking at a percentage in this initial tranche, because we know that there are additional vaccines to arrive that will allow us to continue to cover the high risk, the high vulnerability, the high exposure populations. And the strategy then helps us to reduce the risk of transmission and the risk of adverse outcomes by covering the population in that sequence, utilizing that strategy. So hopefully that answers both of your questions.
Thank you very much. We go now to Wired 868, please.
Good morning, Freyola Botnick, Wired 868. My question believe would go to Dr. Hines. Dr. Hines, last week you mentioned that 50%, sometimes more, of the cases, positive cases that we've seen have been asymptomatic cases, right? And you said they mostly came from contact tracing. I'm wondering, has there been an increase in the testing of asymptomatic contacts, and whether or not we know what impact that could have on the rising cases that we're seeing? Thank you. Just one question today.
Okay, thank you for the question. So yes, we have been ensuring that all of the asymptomatic contacts of individuals who've been confirmed are also tested. And in so doing, we do note that that will increase our ability to pick up on the asymptomatic cases. So yes, that will increase the number of cases that we detect, but we are also conducting the routine surveillance swabbing of individuals who turn up in the health system without a history of contact, but who have respiratory symptoms. So we are looking in more than one direction and in more than one population at the same time, and ensuring that as many individuals as possible can be detected by utilizing these joint strategies. What we do want to continue to encourage people to do is that if they're having any symptoms at all, if they need to seek medical care, they do so and they declare their symptoms and they'll be managed appropriately. If they believe that their symptoms aren't such that medical care is required, we still want to encourage you to isolate yourself. So if you're having respiratory symptoms and you don't need to seek medical care, we still want to request that you stay at home. You isolate yourself from your family members. You isolate yourself clearly from the workplace so that you don't share whatever virus you have. Noting that other viruses are clearly in circulation, you don't share whatever you have with those with whom you come into contact. And again, because of the risk of people being asymptomatic and moving around, the use of the masks, the use of the physical distancing, the avoidance of crowding and clustering of individuals, all of these things are the strategies that are going to help us reduce the risk of transmission at this point in time. So we need to pay even more attention given the fact that we're seeing this current increasing trend. So thank you for the question.
Thank you very much. And we go now to AZP News, please.
Hi, good morning. Priya Vihari, azbnews.com. My first question is for Dr. Hines. Dr. Hines, you said that the recent upsurge, it coincided with the opening up of contact sports. Basically, do you have any contact tracing to show that the new cases were a result of people who took part or were part of any contact sports like that? And second question is for Ms. Campbell. Ms. Campbell, what advice you have for people who have already breached the regulations, people who may have been charged for breaching the COVID-19 regulations, and people who may be roasted on social media for breaching the regulations? What advice you think you have for those people? Thank you.
Okay, thank you for the question. At this point, no. The contact tracing that we have been doing and the information that we've received has shown gatherings in other places, including the bars, including the religious settings, including the workplace, as the places that are listed when we ask where you've been and who you've been in contact with and who's been in contact with you. So it is really sort of an environmental observation. Every time we see an increase or a change, we look back over the 2-week period to see if anything may have contributed to it at a larger or a wider level. And what we noticed is that the beginning of that increase coincided with the 2-week period that we normally look at for having elapsed after the change in those regulations. So while we're not saying that it's directly related to that, we do note that the changes in behavior that are associated with gathering to watch sports, gathering after you've played the sport, etc., those things could drive the increasing spread. And because of that, we're encouraging people to be aware of that and to reduce the risk by altering the behaviors and adhering to the public health guidelines.
Thank you, Dr. Hines. And we go to Mrs. Campbell for a response to the second question.
Thank you for your question. So persons who would have broken the regulations, I think they're at a place where they can be great advocates because they would have experienced the shame, the whatever else from the police, that going through that phase, and I'm pretty sure that they may not want to find themselves in that position again. So they may be at a place where they can advocate, wear your mask. It doesn't matter if you're on the outdoors and you just came out, wear your mask, do what is right. And for those who might be responding negatively to that on social media, the truth is we tend to let our guard down, and it can happen to any one of us. So we want to be encouraging each other as opposed to roasting people on social media about it. You want to encourage each other. If you see someone in your vicinity, someone who you know, whether it is in a religious activity or a sporting facility, and you're not seeing them wearing their mask, you can simply say, "Excuse me, can you pull up your mask, or can you wear it properly, or can you put on your mask? So that we are using this not in a negative way, but in a positive way. So persons who would have gone through the experience, now you have 20/20 vision and you understand what it feels like to be on that end of the spectrum. So you can now do some advocating. You can now do talking to those in your family and those around to wear your mask and to wash your hands. It's unfortunate that you would have been on the other side of the stake in getting having your regulations broken and having to pay a cost for it. But the truth is, some consequences do come at a cost. And it's for us to learn from the experience and to ensure that it doesn't happen again. So thank you for your question.
Thank you very much, Mrs. Campbell. An opportunity to become an advocate for aligning to the new normal guidelines and, of course, for COVID-19 vaccine acceptance. We go to Newsday, please.
Good morning, everyone. Good morning, Rihanna McKenzie from Newsday here. My first question is for Dr. Hines. What has contact tracing revealed about trends in the spread of the cases that we're seeing now? At the beginning of the surge, it was suggested that people were not wearing their masks at work. Then we also heard later that congregation at bars and restaurants was another possible issue. Is it that you're seeing any patterns of behavior that can be addressed, or is it that the spread is just sporadic at this time? My second question, I'm not sure if you can help me with this, but I was hoping for a possible update on the man from Laventille who passed away this weekend of tuberculosis. I understand contact tracing was supposed to be done in that case. Has there been any headway made on that? Thank you.
Okay, thank you for the questions. The information that we have shared in the past and that you outlined actually quite nicely is the information that we continue to share with respect to what contact tracing has found. What contact tracing has found is that there are individuals who would have been in settings where they weren't wearing their mask at work, or where they were in a religious gathering after having been ill, or where they were in a bar and they then moved to another one, and family members of people who were in the bar with them also got ill. We're finding that there are, of course, other cases that turn up without those histories. So that's not the exclusive pattern that is being noted. And because we note that outside of those clusters of people with known contacts, we continue to have other individuals who show up with no known contact. This is why we continue to advocate for the adherence to all of the public health guidelines. So nothing has changed really with respect to what has been identified as the high-risk set of behaviors. That is still the same, and we still have both cluster and sporadic occurrences of virus showing up in the population, and because of that, all of the guidelines remain exactly as have been stated. With respect to your second question, generally anything that deals with tuberculosis is dealt with by the tuberculosis program. There's an entire division, an entire vertical service that manages that. So detailed updates will not be available from us, but we can indicate that all of the relevant contact tracing would have been initiated, and anybody who needs to be contacted as a result of or arising from that situation will be contacted by the individuals that run that particular program.
Thank you very much, Dr. Hines. And just to advise Ms. McKenzie, some information was provided to a colleague of yours at Newsday as it relates to that particular case. We go now to Radio Tambourine, please.
Good morning, Clayton Clark, Radio Tambourine. My question, not sure who it's directed to. Well, this is the week leading up to Easter and the anticipated increase of domestic or visitors from Trinidad to Tobago. Some of them are here already. I visited the airport yesterday and some of the recreational areas. And I am wondering, from your point of view, the Ministry of Health, any sort of special advisory reminders, because we want people to come to relax, local economy, etc. But any sort of additional whether it's signs, personnel, but there were people there without masks and having a good time within control. But any sort of beefed up or added special reminders, signs that are going to be done over this Easter weekend in Tobago and other parts of the country as well?
Okay, thank you for the question. All of the responses that would happen on island within Tobago itself will be driven by the TRHA, the health system and the health personnel that are in charge of the local response there. From our end of things, all of the reminders that we've been speaking about apply. And to quote Ms. Campbell, we can remind each other as well, so we don't have to depend only on official reminders from the Ministry of Health to do what the Ministry of Health has already told you to do. But we can begin to remind each other in these settings. Okay, yes, I know we're hanging in this particular area, and there are only 10 of us, but still we need to have our masks on. So if you're not wearing a mask, please do that. If the numbers become excessive, then we need to disperse. We will also, of course, have the additional support of the police service in ensuring that the crowding of spaces is kept to a minimum and discouraged as much as possible, and really and truly without being too disruptive to that economic activity that you've spoken about. That's as much as the official channels can do to enhance protection. The rest of it is really and truly in the hands of those who are moving about and those who are coordinating the moving, coordinating the gathering, coordinating the stays and the trips. All of that needs to be done against the backdrop of and with the mindset of we're dealing with a pandemic. We can't go about business as usual and ignore the enhanced public health safety guidelines of washing our hands, watching our distance, and wearing our masks.
Thank you very much. And we go now to follow-up questions. First follow-up question from Guardian Media Limited, please.
Hi, good morning again. I just want to get an update on the rapid antigen test kits that we would have received. I believe it was late last year. I remember that it wasn't implemented immediately because there was some verification that needed to be done that wasn't able to be done because we had a low number of cases. But now that cases are on the rise, could we expect to see those test kits implemented anytime soon?
Okay, thank you for that question. As you pointed out, the low number of cases was a bit of a hindrance to getting that full validation. There was some preliminary or interim validation which will be boosted by this additional increase in cases, but there has been a discussion around the best means, the best process, the best algorithm for implementing those rapid kits alongside the rest of the testing. And as that discussion continues and evolves, updates will be provided.
Thank you. And now to Wired 868, please.
Hi, good morning again. This question is for Mrs. Campbell. Mrs. Campbell, you spoke, you kind of drew a parallel to making goals and getting frustrated or along the way towards a goal. So my question is, what kind of impact do you think it has on pandemic fatigue to not have a definite end or milestone towards an end? And what impact is that having on people in terms of coping with fatigue? And what can be done in terms of the messaging by the government to the population and to people themselves as they wait with, no real concrete numbers as to, okay, when it gets this low, we'll end, when we'll get the vaccines, definitely. So how do people deal with that level of uncertainty?
Thank you for your question. It's true. If we have a goal and we have an end date, we have something to look forward to. However, because this is affecting the world at the moment, it's hard to put a timeline. We would hope that vaccines will take away the problem, but we don't know that. This is new for us. So in an effort to keep your anxiety levels down, it's important to deal with this by a day-by-day basis. When we don't have control over something, our anxieties can go through the roof. And what we have to do is to just take it one day at a time, ensuring and hoping and ensuring that your mental health is in a positive place, because we can understand that delayed or that time frame that we don't have, it could have an impact on our mental health. So the tips that we would have discussed before, the coping strategies, those are things that we will want to continue on a day-by-day basis, ensuring that you practice self-care, self-care for the children, yourself, coming to work on a daily basis or being restricted. You know, there are so many limitations to the pandemic, but there are also positives. So it's how we are viewing it. And my advice to persons who may feel overwhelmed at this time and don't have, because they don't have a date to work towards, is taking it one day at a time.
We have questions from TV6 for the first time on the conference. So let's hear from TV6 now.
Vanessa Cutting, TV6 News. Good morning. I just wanted to find out of the new cases you would have recorded over the last 48 hours, how many of those would have come from the prison system? Because I'm aware that we had at least one confirmed case over the weekend.
Okay, thank you for the question. At this point in time, the majority of the cases that we have identified in that 48-hour period did not come from the prison system. Of course, that individual having been identified or confirmed, you will expect and you will note that additional testing, contact tracing, etc. will be carried out, and that the number from the prison system may be updated. But at this point in time, just the one that would have been identified is the only one that currently exists within that system with a confirmed result, and all of the relevant follow-up is currently being conducted.
Thank you very much. AZP News, you have a follow-up question?
Hi, good morning again, Prior ACP News. I just wanted to get a reminder about when we quarantine, when we return home. I have a particular case that from someone who wants to return from Guyana but lives in Tobago. So when they return to Trinidad, must they stay the 7 days in Trinidad or could they be allowed to spend the 7 days in quarantine in Tobago? Just wanted to get a clarified. Thank you.
Thanks, Prior. So the current Ministry of Health policy regarding the returning nationals or persons from medium and high-risk countries, of which Guyana is one, is that persons spend 7 days in state or state-supervised quarantine, followed by 7 days in home quarantine with monitoring by the relevant county medical officer of health. In a case where a person is resident in Tobago, they do spend the first 7 days in state or state-supervised quarantine, and then the following 7 days they are allowed to travel to Tobago. However, there are mitigation measures that are put in place. That is, firstly, CAL is informed that this is a person who is being transferred from Trinidad to Tobago, and so arrangements are made in terms of ensuring adherence to the COVID-19 prevention measures, and especially in terms of spacing that person from the time that they enter the airport for check-in until they depart. Also, we inform relatives in terms of the transfer process, and the person is self-quarantined at home with monitoring by the CMOH in Tobago. So I hope this answers your question.
Thank you very much. Newsday, please, a follow-up question from you now.
Good morning again. Yes, so can the ministry provide an update on the total number of TNT citizens who still need to be repatriated? Yes, they've been coming in slowly but surely, but do we have a figure for people still to come? Thank you.
Thank you very much for that question, which I know is very topical. Border control and the controlled entry of Trinidad and Tobago nationals, as well as persons entering from the essential services, falls under the purview of the Ministry of National Security. As such, any sort of information regarding your requested statistics would really have to be directed to the Ministry of National Security. The Ministry of Health is responsible for quarantine arrangements once persons enter Trinidad and Tobago. Thank you.
Thank you very much. And back to CNC3, please. Okay, CNC3 is fine. So let's go to AZP again. Oh, and we have no's. I see we have no more questions this morning. Thank you, everyone, for participating. I know that the holidays in Trinidad and Tobago are really a time for gathering with family and with friends. And even as we move into the vaccination of our healthcare workers to start, and persons who are 60 and over with NCDs, as was indicated in the media conference on Saturday, please remember that COVID-19 is still with us. We are still in the middle of a pandemic. Remember your 3 W's. Wash your hands, watch your distance between yourself and others outside of your household bubble, and of course, wear your mask.
Are you ready to get on back? Anybody from Shagona? Pick up this Shagona massive. Anybody from St. James? Woodbrook? Mova? Lavatel? San Fernando? Anybody in the country? I trip in the street. I get on my feet and something like that. I'm moving up the body. So they can see it. They're on the country.
As the wife of the Prime Minister, and he's been, it seems, in public life most of his life. Right. Have you as a woman suffered any hardship as a result of that?
The word hardship. Now, what I would say is, because, for instance, Keith and I got married in 1985. So there have been sacrifices. I say I married a geologist. I didn't marry a politician. And I then became the wife of a politician, the wife of the opposition leader, the wife of the Prime Minister. He's serving the country. I appreciate that. You play second fiddle to the country.
Yeah.
I don't mind playing second fiddle to the country.
Well, I've been judging for Red Cross for a number of years. And I think a competition like this is important.
And I'm very happy that the Red Cross is celebrating this event, given all that we had to go through.
What's unique about it is it's during a pandemic.
It puts them on the side of the designer rather than just being the mass player.
Designing is basically international. You might send in a design for some international situation, and here it is, you end up representing the red, white, and black.
This is a wonderful opportunity to celebrate our youth.
One, to push our culture, and also to show them that you can have a career in this creative industry.
We're looking forward, to the excitement. I believe that, the future of Carnival is definitely in their hands.
We're all here to support them.
TTT News. Connect.
I solemnly pledge to dedicate my life to the service of my God and my country. I will honor my parents, my teachers, my leaders,
and my elders, and those in authority.
I will be clean and honest
in all my thoughts, my words, and my deeds.
I will strive in everything I do